Thyroid disorders are very common in clinical practice, and it's also very common that a patient goes to their doctor complaining of thyroid symptoms such as cold hands and feet, brain fog, constipation, hair falling out, skin and nails are unhealthy, and the doctor runs thyroid labs and tells them their thyroid is normal and sends them on their way. The patient continues to get worse because obviously the thyroid is not normal, and they go back a month or two later. The doctor may run labs again and says the thyroid is normal, sends the patient on their way. Patient comes back again, and by now they're probably crying or very frustrated at the visit. I'm having these thyroid symptoms. You keep telling me I'm normal, but I know I'm not. Help me. The doctor runs thyroid labs again. They are normal. So the doctor then says, oh, maybe it's in your head. Here's an SSRI or a benzodiazepine. Here's a psychotropic medication to help with your anxiety or your depression. And now that patient leaves even more frustrated because they don't feel heard and they're not being served. Well, is that patient's thyroid actually normal? Has the doctor done the workup to be able to definitively say that that patient's thyroid is normal? The answer, most commonly in conventional medicine, is no. The work hasn't been done to definitively say that that patient's thyroid is normal. What work needs to be done? That's what we're going to dive into today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. In this situation where the doctor's telling you your thyroid is normal, we have to ask, what is their normal definition based upon? And in the typical standard conventional medical office, the labs that they ran to tell you your thyroid is normal are thyroid stimulating hormone. But doc, you just said labs are. Those are plural words. So what are the other labs? Exactly. In the typical office, the standard of care is TSH only, thyroid stimulating hormone. Is that enough to definitively say that a person's thyroid is healthy or unhealthy? Typically, no. The one caveat is that conventionally and by medical standards, if TSH is lab high, then that is diagnostic of hypothyroidism. So in that instance, medically they can say definitively the thyroid is dysfunctional and they have hypothyroidism, which is a known disease. But in all other instances, we cannot say that the thyroid is normal. So a normal TSH does not rule out thyroid issues or thyroid dysfunction. All it does is rule out hypothyroidism. And from a conventional medical perspective, if you don't have hypothyroidism or something else blatant like hyperthyroidism, then your thyroid is normal. Until one of those two things occurs, then it's abnormal. Well, why does this fail so many patients? Why is this method a substandard of care? Because as any thinking person can figure out, there is not an all or nothing methodology to physiology the way that conventional medicine operates. In other words, they say you either are abnormal or you're normal. Between normal and abnormal though, or diagnostically abnormal, is sick. And it's a whole spectrum of things that could go wrong before you fit diagnostic criteria to be abnormal. So how would we track someone on their way to abnormal? So someone who's not normal, but someone who's not definitively abnormal by conventional medical standards. Well, the first step would be to run a thorough thyroid workup. And that is not being done according to standard of care in conventional medicine. A full thyroid panel is 9 markers. So a full panel is 9 markers. TSH is 1/9 of a full panel. If you're quick at math, that means it's 11% of a complete and thorough workup. Well, 11% doesn't give us a whole lot of information to go by and say, you're normal. There's nothing wrong with your thyroid. A metaphor I use to explain this is pretend that you, the viewer, are a realtor And me, I'm a person who's selling my home. And I say, Mr. or Mrs. Realtor, I want to sell my house. Can you sell it for me, yes or no? As a realtor, you may say, well, I have a few more questions, let's say 8 more questions, in order to answer you confidently. Like, where is it? What's the square footage? What's the lot size? When was it built? Etc., etc. And I say, no, Mr. Realtor, I don't want to answer those questions. Can you sell my house, yes or no? How can you definitively say yes or no? Because this house could be anywhere and in any shape. Well, that's what they're doing with the TSH. They're looking at your TSH and saying that your thyroid is good or bad, when there's really 8 other questions, or 89% worth more of information that we need to definitively say that. So if you're a person that fits the avatar that I was speaking about in the beginning of the video, you've had lots of symptoms that you've Googled and you know are thyroid symptoms, and they've progressed even though your TSH over time has continued to look normal, and now you're frustrated because the doctor isn't hearing you, well then what you need is the rest of the questions to be asked, the other 8/9 of the equation, so someone can definitively tell you if the thyroid is dysfunctional or not, and then determine what to do to correct the abnormalities that are there. Now, if you're hoping to get that in a conventional medical office, it's highly unlikely that you're going to get that, because even in-depth testing in a medical office often only includes a TSH, a free T4, and a total T4, which is 3/9 of the equation. That gets you up to 33%, but there's still 66% you don't know. So to look thoroughly, you need to work with a practitioner that does the detective work to do the thorough, full 100% checking on your thyroid, so that then without a shadow of a doubt, we can say, yes, there's something wrong with your thyroid, and it's right here, and this is what we need to do, versus, can you sell my house, yes or no, tell me right now. So if this makes sense to you and you're someone struggling with the symptoms and this experience as I've described, seek out a functional medicine practitioner that can do the work and understands thyroid physiology and how to address whatever is found, and you'll be headed on your way to a life at optimal. If you would like to partner with me, that is something I take great joy in, and thyroid is something that we can have great success in if we understand what's going on beneath the surface.